Brandon Aiyuk of the San Francisco 49ers suffered a very serious looking knee injury today against the Kansas City Chiefs. Interesting, in this case, he was actually able to walk off of the field while obviously favoring that leg, and then eventually he did require to be carted off into the locker room. At the time of me making this video, we don't know the specific injury that Aiyuk is dealing with in his knee. However, the 49ers have officially ruled him out for the remainder of the game. Although we don't know the specific structure involved in this injury so far, we do know that based on the injury mechanism, this is something very consistent with something known as an unhappy triad or a terrible triad injury. And this is an injury that can actually affect three structures located in the knee, being the ACL, the MCL, and the medial meniscus based on the direction of force. So with today's video, I want to go ahead and start off by looking at the injury replay. I'll discuss the relevant anatomy in the knee, and then finally we'll talk about best and worst case scenario. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they are a little bit easier to understand. I will talk about the pertinent structures for that injury, and finally, I'll talk about what that person should expect when coming to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel, because I will be making more of these videos in the future regarding sports injuries, rehab, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Here on the replay, we see Aiyuk has the ball, and as he is trying to run, the defender is going to come in and hit him. We see his knee bend very awkwardly. Here's a model of the knee joint, and so the knee is formed by our femur bone, also referred to as being the thigh bone, that's going to come down and form the top part of the knee here. Then at the bottom piece here, we have two long bones located in the lower leg. The first and big one here is the tibia, also called the shin bone. That's going to come up and form the bottom portion of the knee. And then as we flip the model towards the outside here, we have the fibula bone. There are four main ligaments located in the knee that contribute to overall knee stability. And the first one is known as the anterior cruciate ligament, also called the ACL, which is located right through here. Then as we flip the model towards the inside or medial portion, we have the medial collateral ligament, also known as the MCL. As we flip the model towards the outside here, we have the lateral collateral ligament, also known as the LCL. And finally, on the back here, we have our posterior cruciate ligament, also known as the PCL. There are also two other important structures that are located within the knee joint itself. They are the medial and the lateral meniscus. You can think of these as essentially basically shock absorbers between the femur and tibia bones. So let's talk about the mechanism of the injury here. We see that as the defender comes in, he's going to make contact with the lateral or outside portion of Aiyuk's knee. As he does this, that knee is going to bend very awkwardly. So the direction of force in this case is coming from lateral to medial, and we also look like we're getting a little bit of knee hyperextension as the impact occurs. So the knee is going to be bending backwards the wrong way. As I take the model here through knee hyperextension, you can see that that wants to stress all of the structures that are located within the knee, including that ACL and that MCL. Also, as a force is coming from lateral to medial, that greatly wants to gap this MCL. And when somebody gets enough of a force going from lateral to medial, known as a valgus force, and sometimes there's a little bit of a component where they're actually posterior lateral going to anterior medial. As they do this, this can actually damage the MCL, the medial meniscus, and the ACL. So that's why this is called an unhappy triad mechanism. The main function of the ACL is actually to prevent any sort of anterior translation or any anterior movement of the tibia. And you can see on this model here that this is the motion that's going to be checked by the ACL. So if there is any sort of posterior to anterior force, we know that the ACL could be implicated. And then of course, going into knee hyperextension, we know that the ACL is at risk, unfortunately. So when we see this type of a mechanism, we immediately think that it's going to be a severe knee injury until ruled out otherwise. Now, there are some on the field or in the clinic tests we can do to essentially rule in an ACL injury. The gold standard for this is known as the Lockman's test. And so what we're going to do is we're going to stabilize the person's femur, and we're going to grab their tibia, and we are pulling on that tibia like I demonstrated earlier. And what we're going to do is we're going to compare this to the non-injured side. And if we feel laxity and we feel like the knee is moving too much, and this makes us think that they're dealing with an ACL injury. The same can be done for the MCL. If we think the MCL is implicated, what we're going to do, we're going to stabilize the person's leg like so, and we're going to provide that valgus force going through the knee. And you can see here as I do that, that wants to gap it. Once again, we compare this to the non-injured side. And then if we feel more laxity in the injured side, then this makes us think that the MCL is implicated as well. The gold standard, obviously in this case, to essentially diagnose what is going on with Aiyuk's knee is going to be the MRI, and he's going to have that hopefully pretty quickly, and we get the results of that. But there is a grading system for these ligament injuries. There are grades 1, 2, and 3. In a grade 1 ligament injury, you're getting maybe some microscopic tearing of the ligament, but you're predominantly getting stretching. In a grade 2, this is where you're going to get partial tearing of the affected ligament. And finally, in a grade 3, this is where you're getting a full rupture. If someone is dealing with a grade 1 knee injury, oftentimes we call this a knee sprain. This is going to sideline them from a few days up to a few weeks. It really depends on how many structures are affected in the injury, and it depends on how they are presenting. If it's a grade 2, because you're getting partial tearing, this can take a few to several months. And finally, in a grade 3, obviously this is the absolute worst case scenario. Person is going to require surgical intervention to repair everything that's been damaged. So the obvious concern in this injury mechanism right here is the fact that the ACL could be involved. The absolute worst case scenario is that it's going to affect the medial meniscus, the MCL, and the ACL. Best case scenario is that it's going to be along the lines of more of one of those low-grade sprains. We've seen this with similar mechanisms in the past, and we've seen actually a couple times where somebody's knee goes into severe hyperextension and it ends up being a low-grade sprain. So we hope that Aiyuk gets lucky in this case and that we get the results of the advanced imaging and that it comes back to be one of those lower grade sprains. When we get somebody in physical therapy after one of these grade 1 injuries, essentially what we want to do in the initial phases is we want to follow that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. Basically, what we want to do here is we want to pump out as much inflammation and swelling as possible from the knee joint so that we can start getting them moving again. So what we want to do is we want to restore the normal range of motion to the knee, want to start to build up strength again, and finally work in sport-specific movements when it's appropriate. Now, if this happens to be the absolute worst case scenario that's going to require surgery, usually what they're going to do here is an ACL reconstruction, and they may or may not repair the MCL. It really depends on the case. So if this happens, usually they're going to reconstruct the ACL. The MCL is potentially going to be repaired. And with the meniscus, what they can do is they can either do a meniscectomy where they cut out the injured piece, or a full meniscus repair where they're essentially just going to repair the lesion. The entire rehab process for this would take several months, up to about 1 year. Unfortunately, it's going to sideline Aiyuk for the remainder of the season. So this would be the absolute worst case scenario. We hope that's not what he's dealing with, but if we were to see somebody in the clinic, that's what to expect moving forward afterwards. If I happen to hear any updates regarding Brandon Aiyuk's case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So we wish Brandon Aiyuk the best of luck moving forward with this injury. We hope that it's not going to be something that's going to sideline him for a significant period of time. But thank you so much for watching my video today. If you enjoy this sort of content, I'm going to go ahead and link another one on my playlist so that you can watch some of the injuries that I've talked about in the past.